Welcome to the Nordic Venture Show, your speed date with the hottest Nordic innovations and ventures. In this episode, our venture date is with CardioSignal, smartphone detection of a common heart rhythm disorder.
Okay, so today we're going to jump into something that's pretty cool. It has to do with heart health and maybe a new way to detect some issues.
Sounds intriguing.
Yeah, and the crazy part is it uses something that you probably already have, like right there in your pocket.
Oh, I'm interested already. Tell me more.
We're talking about smartphones and how they might be able to pick up on heart rhythm problems like atrial fibrillation, AFib.
Wow. Using a smartphone to detect AFib. That's pretty amazing technology.
Right. We dug into some research on something called CardioSignal.
I've heard of that. I'm excited to learn more.
Yeah, so in this deep dive, let's really break down how this thing works.
Yeah.
You know, what's the science behind it all and what it could mean for anyone, really.
Absolutely. So we're basically looking at how everyday tech can become a powerful tool for keeping tabs on our heart health and maybe even catching serious problems early on.
Okay, so let's start with the basics. AFib, why is it so important to catch it early? What's the big deal?
So AFib, atrial fibrillation, it's when the heart's upper chambers, they kind of go haywire beating irregularly and often way too fast.
Yeah, I've heard it can be pretty serious.
It can be. The tricky part is a lot of people, they might not even notice anything wrong.
Really? No symptoms at all?
Sometimes the symptoms are really subtle or they come and go, so people might just brush them off.
That's scary.
It is, because even if you don't feel it, AFib can increase your risk of some major issues like stroke.
So that's why early detection is key.
Exactly. Early detection means you can get on top of it with the right medical care, manage the condition, and seriously lower those risks.
Makes sense. So where does CardioSignal fit into all of this? What's their solution for catching AFib early?
Well, CardioSignal is this really interesting smartphone app, and get this, it's actually classified as a CE-marked Class IIA medical device.
Wait, so it's not just some random health app. It's an actual certified medical device.
Yep, which means it's gone through some pretty rigorous testing and meets the European standards for safety and performance for medical devices.
That's reassuring, especially when we're talking about something as important as heart health.
Right. And the way it works is pretty clever. It uses the motion sensors already built into your phone, like the gyroscope and accelerometer, to detect signs of AFib.
So those things that tell your phone which way is up and help with like screen rotation in games.
Where very same sensors can pick up on subtle movements related to your heartbeat.
Wow, that's amazing. And I guess the biggest advantage here is that you can use it pretty much anywhere, anytime.
Wow, that's the beauty of it.
Yeah.
No need for bulky equipment or special trips to the doctor's office. It's all right there in your pocket.
Super convenient. And where is this app available right now?
So it's available in a bunch of countries across Europe: Austria, Denmark, Finland, France, Germany, Ireland, Italy, Spain, Sweden, Switzerland, the UK, Netherlands, Belgium, Norway.
That's a pretty good reach.
Oh, and they've also launched in India.
Nice, expanding globally. So in our research, we also saw that this tech might be used beyond just you and me checking our own hearts. Like it could be used on a larger scale too, right?
Right, absolutely. There's definitely potential for broader applications. For example, healthcare providers could use it for larger screening programs, maybe even at a community level.
Interesting. So they could potentially identify people who might be at risk without even knowing it.
Exactly.
Yeah.
And there's also the possibility of using it in clinics, as a quick initial assessment tool.
So kind of like a first line of detection.
Yeah. But, for our deep dive today, we're mainly focusing on how this tech can benefit individuals directly.
Okay, that makes sense. So back to the app itself. It uses the phone's motion sensors. But how do those sensors actually pick up on something as subtle as an irregular heartbeat? It's not like it's listening with a microphone, right?
Nope, it's not using sound at all. This is where the science of gyrocardiography comes into play.
Gyro what?
Gyrocardiography. It's a fancy name for a pretty cool concept. Basically, it uses the phone's gyroscope and accelerometer to measure the tiny movements of your heart.
Wait, so our phones can actually feel our heart beating?
In a way, yes. The heart's contractions, they create these little vibrations and rotations within your chest.
Huh, interesting.
And the sensors in modern smartphones, they're incredibly sensitive. They can pick up on those minute motions.
That's wild. So it's not about sound, it's about actual physical movement.
Exactly. It's sensing the mechanical activity of your heart.
So those sensors pick up on the specific rotational movements of the heart. And I read that this whole approach is actually patented, right?
It is. It's a unique and protected method for detecting heart motion.
A patented heart motion detector in my pocket. It's kind of blowing my mind a little.
Okay.
So this isn't just some idea someone came up with. This is based on some serious scientific research, right?
Oh, absolutely. This technology is backed by over a decade of academic research. We're talking more than 20 peer-reviewed publications in scientific journals.
Wow, so it's been rigorously tested and studied?
You bet. And on top of that, the technology has been validated in several clinical studies. So we're not just talking theory here.
Okay, so let's talk numbers. When it comes to detecting AFib, how accurate is this thing?
So the clinical studies have shown some really impressive results. The overall accuracy for detecting AFib is around 96%.
96%? That's really high.
It is. And when we break it down even further, the sensitivity, which basically means how good it is at correctly identifying AFib, is about 95.3%.
Wow. So it's very good at catching those cases where AFib is actually present.
Right. And then there's the specificity, which measures how good it is at correctly saying when AFib is not present. That sits at around 96% as well.
So it's good at avoiding false alarms, too.
Exactly. And those figures are based on a key study called the MODI-AF study published in the journal Circulation back in 2018 by Jacala and his team.
So this technology is approaching medical-grade accuracy using just a smartphone. That's a game changer.
Definitely. And the exciting part is that the research isn't stopping there. They're looking into whether this gyrocardiography tech can detect other heart conditions too.
Like what? What else might they be able to pick up on?
Well, they're exploring things like heart failure, aortic stenosis, coronary artery disease, even pulmonary artery hypertension.
So a whole range of cardiovascular conditions.
Yes. And they're also looking at its potential for monitoring key heart metrics like VO2 max, which tells you how well your body uses oxygen during exercise.
Wow. So the applications could be really broad in the future.
For sure. And to give you a sense of just how much research is going on in our sources, we saw several publications highlighting this work.
Yeah, I was going to say, we saw some really interesting papers. Can you walk us through a couple of examples?
Okay, so one of the foundational studies was that 2018 paper in Circulation, the one we mentioned earlier, Mobile Phone Detection of Atrial Fibrillation.
Yeah, that one really established the potential of using smartphones for this purpose.
Right. Then in 2019, there was a paper in the IE Sensors Journal called Standalone Heartbeat Detection. That one really delved into how these phone sensors can isolate and analyze individual heartbeats.
Fascinating. So they're getting down to the nitty-gritty of how these signals work.
Uh-huh. And another one that caught my eye was from 2018 in Scientific Reports. It was titled Multi-Class Classifier-Based Cardiovascular Condition Detection.
So that one hinted that this tech could be used to diagnose more than just AFib.
Exactly. And just to show you how the research is still evolving, there's a 2022 paper in the journal Sensors that looked at using a related technique called mechanocardiography to detect changes in heart failure patients.
Wow, so much research and so much potential. It's really impressive. Okay, but let's switch gears for a second. For those of us who might want to try this out, what's it actually like to use CardioSignal? How does it work in practice?
Well, the app is designed to be pretty user-friendly. First, you download the CardioSignal app and create an account. Pretty standard stuff.
Easy enough.
Then, depending on how you're accessing the app, you might need to subscribe or activate it through some kind of program or study.
Okay, makes sense.
Now, when you're ready to take a measurement, it's super simple. You just lie down comfortably, place your phone flat on your chest, and hit the start button in the app.
That's it?
That's it. The measurement only takes about a minute.
Just 1 minute. That's pretty quick.
Right. Once the measurement is done, the app crunches the data and shows you the results.
And how often are you supposed to do this?
For the best results, they recommend taking measurements twice a day, ideally.
So morning and night, maybe.
Something like that. And to make it easier, the app has some handy features. You can track your heart rate variability, respiration rate.
So you can keep tabs on those key metrics.
But it's important to note that the app states clearly that these are for general wellness purposes, not for actual medical diagnosis.
Okay, good to know.
Sure.
It's not replacing a doctor, but it can give you some useful insights.
Exactly. The app also lets you see your past measurements, set reminders so you don't forget. And it even has a news feed with information about heart health.
So it's kind of like a little heart health hub right in your phone.
Yeah, pretty much. Okay, now here's a key question. What happens if the app detects something that looks like AFib? What should you do?
That's a good question. Because as we said, it's not a replacement for a doctor's diagnosis, right?
Right. So if the CardioSignal app suggests you might have signs of AFib, the most important thing is to see a doctor.
Makes sense. So don't panic, but definitely don't ignore it either.
Exactly. You should schedule an appointment with your primary care physician or a cardiologist and show them your measurement history from the app.
That way they can make a proper diagnosis and figure out the best course of treatment.
It's all about early detection and getting the right medical advice.
Okay, that's really important to remember. This app can be a powerful tool, but it's not a doctor. Now, you mentioned subscriptions earlier. Can you give us a rundown of what the different options cost?
Sure. So there are a few different plans to choose from. You can go monthly, 3 months, or a full year. And usually the annual subscription gives you the best deal per month.
I see. Makes sense. And what are we talking about price-wise?
The prices I saw were around 4.99 euros per month, 13.99 for 3 months, and 34.99 for the whole year.
That's not too bad considering the potential benefits.
Right. And they offer various ways to pay, like major credit and debit cards, Google Play or App Store gift cards, PayPal, and even carrier billing in some places.
Okay, so they're making it pretty accessible. I think a lot of people might be wondering about the security and privacy of their health data. Is it safe to trust an app with this kind of sensitive information?
That's a really important concern, and CardioSignal seems to take it seriously. They're very transparent about their commitment to quality and data protection.
How so?
Well, first off, remember that CE marking we talked about earlier? That already indicates a high level of quality and compliance with European medical device standards.
Right. It's not just some app that anyone can throw together.
Exactly. On top of that, they've got ISO 13485 certification, which is a specific quality management standard for medical device companies.
So they're really following the best practices in the industry.
Yes. And to top it off, they're also ISO 27001 certified for information security management.
Okay, so they've got their bases covered in terms of data security.
It seems that way. They're really emphasizing that they're handling user data responsibly.
That's good to hear.
Yeah.
Before we wrap up, there was some recent news about CardioSignal that I thought was interesting.
Oh, yeah. What's that?
Well, they just appointed a new medical director, Dr. Blaj Marevlia.
That's great. Having strong medical leadership is so important.
Totally. And they've also partnered with Heart Center Mulholm to use their tech to help patients recover after cardiac events.
Wow. So they're really expanding the ways they can help people.
And they presented some new data at the big European Society of Cardiology Congress in 2024.
Oh, interesting. What was the focus of their presentation?
It was all about the reliability of their AFib detection tech, particularly in people who were suspected of having various heart conditions.
So even more validation of their approach.
Exactly. Seems like they're constantly working to improve and refine their technology.
That's good to see. Innovation doesn't stop.
Yeah.
So to sum up our deep dive, it seems we've got this really cool tech that uses our smartphone's motion sensors to do something called gyrocardiography.
Right, basically feeling the tiny movements of our hearts.
And the CardioSignal app analyzes that data and can detect potential signs of atrial fibrillation with pretty amazing accuracy.
All backed by a ton of research and clinical studies.
Yep, it's a convenient and accessible way for people to keep an eye on their heart health and maybe catch AFib early on, which is crucial.
It's pretty incredible when you think about it that we have this kind of power in our pockets.
It really is. This is a prime example of how everyday tech can be used to empower people to take control of their own health.
And the innovation all comes down to using something we carry around all the time to sense and interpret the incredibly intricate workings of our hearts.
It makes you wonder what other health breakthroughs might be just around the corner, right?
Absolutely. So here's a thought for our listeners. Given all this progress in smartphone-based medical devices, what other aspects of our health might we be able to monitor in the future?
Yeah.
Non-invasively just using our phones.
And what will that mean for the future of healthcare? Will we all become more proactive about our health? Will we be able to catch more diseases early on?
It's a really interesting question to think about as this technology continues to evolve.
Definitely. It's a whole new world of possibilities, and it's just getting started.
Thanks for diving into this with me today. It's been fascinating.
My pleasure. I always enjoy exploring these cutting-edge topics.
All right, that's it for today's deep dive. We'll catch you next time.
See you then. Bye.
Thanks for listening to the Nordic Venture Show. Don't forget to subscribe and stay tuned for more stories of innovation from the Nordics.